Hey guys, so if you're watching this, it means I actually decided to put it up. This was for the cervical nerve block that I had done in March. This was March 1st of 2024. I had a cervical nerve block done that helps with the neck pain that I was having, which they were hoping would also help reduce the amount of migraines that I was getting, because they thought that that was also helping contribute to a lot of the migraine symptoms that I was having. Now, granted, I have, I've had whiplash over the years. We had that car incident in that Uber driver's car in September last year, where we had sustained some whiplash due to that driver's poor driving. And so we had some neck damage and whiplash from that. So we did have some neck injuries from that, but also, I've had a stroke and there was damage in my neck from a stroke. So I had pain due to that. Plus, I also have scoliosis in my upper back and cervical spine. So they were hoping that the cervical nerve block would help reduce the amount of neck pain, which it has greatly reduced the amount of pain that I have in my neck. But it has not. It has reduced some of the migraine symptoms that I have, but this procedure that I recorded, now granted, most of this is just like me, like talking with the nurses and like them trying to wake me up and some slurred speech and stuff. So this is really just, me recording it for my own peace of mind. And they knew I was recording, so it's not that I didn't have permission to do this. And I wasn't like recording anybody without their knowledge, that kind of thing. And the nurse, if you listen towards the very end, like when he's removing my IV, I literally apologized for my arm hair. So that just goes to show that I really am just a nice person, even under the influence of drugs. I literally apologized to him for my arm hair being in the way and making his job harder. So, yeah, so that's what this is. This is just the surgery that I had done on my neck. This was an outpatient procedure. This is the entire video. This is all of it that was recorded. The entire procedure and everything, pre-op, post-op, the whole thing was the entirety of the video, all the way for the elevator ride. I do not remember. I remember getting in the elevator. I don't remember the elevator ride. I don't remember getting in the car. I remember going to Wendy's and getting a burger, and then I don't even remember getting home. So that tells you how drugs. So I'm going to do an outro on this, but then the rest of the video is what it is. There's some like minimal blurbs of talking in here and there, and me talking with the nursing staff and me talking through like how bad I freak out with needles and stuff like that. So, and how I cope with like needle sticks and things like that. But yeah, hopefully if I do publish this on YouTube, it'll probably go up on my main channel and not on the gamer channel. And yeah, hopefully you guys find this informative. I do talk about a few things here and there on this video that might help some people out, especially if you're like afraid of needles like I am. And maybe some of my tips and tricks might help somebody else. And hopefully you guys have a great day. Enjoy the video.
Here you go. You just sign this paperwork real quick. It wasn't in the packet.
No, well, I thought Rita had set it up, but you know what? Look, I freak out with needles, so just warning you now.
Okay, here it is. Well, I'm gonna get an IV going for you.
Alright, and
I should have lifted my bag.
no, you're okay.
When you have a migraine, your brain just doesn't function very well.
I completely understand that.
And they said, no more migraine meds after like 10 o'clock yesterday morning. And I'm like, oh, yeah.
And then there's one more.
Yeah, I figured I better flip this time.
Thank you.
Mm-hmm. Now, jacket off. I am wearing a long sleeve shirt.
You're good. I'm gonna go in your hand.
Oh, shit. I hate that.
I know, I'm sorry.
I was going to say, actually.
So they have to go, we have to have an IV. Yep, that's fine.
Okay, right there's
Anywhere
usually
there
pretty
and
good.
down. Yep.
Just last time I went from 131 pounds to 205 due to gabapentin, and oh well, I mean it works great for fibro and stuff, but man, I was on it for like 20 years, never had a problem, and started taking it after the age of 40. Holy shit. I didn't expect to get that big, but then they couldn't find my veins anymore, and I usually have like super good veins.
Yeah.
But this one here is usually pretty cooperative. If you can see, I've got several scars there.
Yeah, you're good. Okay. I'm gonna put you here. Yep, relax that arm for me. Thank you. I'm gonna let that sit for just a second.
It doesn't even feel very tight.
Hey, Shayla or Sam or somebody, can one of y'all bring me a different flush? They gave me like a half full flush.
Yep.
Which does me no good. I think they ordered the 5cc flushes. We need the 10cc flushes.
Uh-oh. Well, and I'm a bleeder, and I see somebody else is a bleeder as well.
I'm sure.
Oh, Lord. I can open that for you.
You love it.
That was so annoying.
You're
I'm like,
good.
here you go. Your hands are full.
You're fine.
We're going to get that up what she's doing.
Look, I know y'all are good at multitasking. My aunt was both my mom's sisters were RNs.
Oh, yeah.
And I did medical transcription for like 16 years. So I like typed all the stuff that y'all did, but I couldn't stick nobody with needles. I couldn't even do like,
You just get used to it after a while.
I can't. Every
especially-
time when I did my first responder training and stuff like that, every time I had to go at anybody, I mean, like I can do sutures, but every time I stuck the needle in, I thought I was gonna vomit. I'm like, what?
Yeah,
I can't do it.
I get it.
Like,
totally get it.
I mean, I've done sutures on people before, but when it comes to like, I've done like lances on animals and aspirations and stuff like that. Oh my God. I just, it bothers me so bad. One of my cats got in a fight with a neighbor cat, and before I could get him into the doctor to get him on antibiotics and stuff, his foot was like 5 times his normal size, so I knew I had to lance it and express it. I was like standing in the tub with him, he's looking at me like, I know, Mom, it's okay, and I got my scalpel out and I sliced it open, and I'm like, oh my God, I about threw up in the tub.
Yeah. Oh gosh, yeah.
He was fine. I was the one losing my shit.
Right. He's like, I'm good. We're good.
He was the
Okay.
best boy. But yeah, he had like 21 bites on the one arm. He tore the shit out of the other cat though. My cat was half Maine Coon, so he's a big
Okay.
motherfucker.
Yeah.
You know, that bobcat part kind of kicks in.
Yeah.
You waiting for it to show it to you? I know it can roll. That one is usually pretty good though.
That one normally cooperates.
Yeah. If you're nice to it.
Right? Big stick, okay. Sorry, I have to kind of, yeah.
It's fine. I know you gotta find it. I'm not gonna watch nothing. I don't need my blood pressure going up in anymore.
Right? Let's try what it was trying to do. If I can just disappear. I really need it not to do that. Not pop this glove, sorry.
You're fine. You need a finger.
Feel it, yeah.
Yep.
There we
Said
go.
nope.
Yeah. Jeez. Okay, there we go. Sorry.
No, you gotta do it. I've been poked and prodded for the past 25 years, so I should be used to this shit by now.
Sorry. I don't think you ever get used to it, you know?
When I was a kid, I'm from Central Florida. We were down in a hospital in Orlando. I had broken my arm. And I had done a green stick break, so it wasn't a clean break.
Ooh, girl.
And it splintered in my arm.
Oh,
And
God.
it was this one. And come to find out, that's why I can write with both hands, because technically I was a lefty.
I mean, hey, at least you got something.
Right? I can write with both hands. I can write with my feet.
Right. Oh, wow, that's cool.
I can unlock my phone with my nose.
Oh, that's awesome.
God, I hate that stuff.
Oh, no, I'm sorry. I should have warned you, like,
Yeah.
hey, you're going to get a funky taste.
Yeah. No, I knew it was coming. I could smell it first.
Yeah.
But they had 2 big hospital security guards come sit on me because they were trying to get blood, and I would not.
That's traumatizing.
I was 5. It took 2 big dudes to hold me down though, because of the fact that I couldn't. I'm like, nope. You showed me that needle, I was done.
Right.
I did. I got up. One guy was literally sitting on my lap. I got up. I squiggled up from underneath of him and was halfway down the hallway for them to grab me.
You were like, I'm running.
I was
You're
like,
not
fuck
doing this to me
this.
again.
Nope.
You can,
Yeah.
I don't care what you do.
Yeah, a whole lot of nope that day.
I get it. I hate needles, and I'm a hard stick, so they always have to sit me like 4 and 5 times. I'm like, shit.
No.
Please, can you stop?
No, that's why I'm like, okay, just breathe, because the more I tense up, the more I freak out, my veins go.
Yep. Yep. I was talking people I had somebody a few minutes ago, and she was like, she would flinch when I did anything, and I was like, I really need you to relax for me. She's like, well, I'm keeping my hands strong. I'm like,
Yeah, no, it's really is a
it's
mental
whole
state.
body, like it's a when your veins move when you tense up like that.
Yeah.
So I just try.
Well, and it doesn't help that it's cold. It's like super cold in here, which it has to be because it's sterile. But one thing I learned years ago, if you have somebody that's like psyching out like I used to, have them count their breaths. It focuses them on, number 1, breathing, but 2, how often they breathe, how deep they breathe. They're focusing on the actual act of breathing, and they get distracted. And I have ADHD.
Right.
But I'm also bipolar, so I've got like 1,000 things going on in my brain at once.
All the time.
So in order to get my brain to like shut the fuck up for a minute, I have to focus on my breathing. And I have found that distraction technique allows people to relax. And
I'll
try that.
I'll
Say, count your breaths.
Yeah.
Count your breaths. How deep are you breathing? And
Right.
like get in their brain
Like
and
to-
make them
to
focus
focus
on
that?
that. And it should help.
I'll try that.
You're welcome. I don't. No.
No, okay. Any heart problems?
I mean, I had a heart attack at 27, but
At age 27?
yeah, I'm 43 now.
And what was that related to?
My ex-husband was poisoning me with belladonna.
He was poisoning you with those?
Yeah,
Okay.
he wanted my life insurance policy. And then he hit my daughter in the head with a camera to try and get hers, so. Oh, yeah,
Oh,
very
geez, that's a lot to recover from.
Yeah, no, I spent 15 months and 3 days in jail because of him.
You spent time in jail because of him?
In Florida, whoever calls first is considered to be the victim. Research it. I'm serious.
Oh,
I
really?
used to work law enforcement.
Oh, geez, that's crazy. So he called first?
Yeah.
Oh.
Well, he left me home. I was basically wheelchair bound. So
You were what, wheelchair
I was wheelchair bound. I had had a stroke and a heart attack, so
Oh.
I was basically immobile on my left side. I couldn't even do this for the first 2 years.
Oh, okay.
So-
Wow.
I'm tough.
Yeah, I'd say so. That's a lot to get through. Is your daughter okay?
She is now. She's 20.
Okay.
She doesn't remember most of it, which is probably a good thing.
Yeah, how old was she?
She was about 5.
Okay.
She was almost 5, so that was a lot.
That's really scary. And where is he now?
In Washington or Oregon, somewhere way out there.
Okay.
How you feeling?
Wow.
And if he ever comes
Okay.
back this way and I see him again, he never wants to be
Feeling
within.
alright?
He what?
He said he never wants to be within 100 feet of me.
Oh. Okay.
Yeah, because there's a restraining order.
Yeah, you did real
Against
good.
you?
No, against
Oh.
him.
You have one
Like I said,
against
he can't be within 100 feet.
Oh, okay. Wow.
Your hand.
Frightening.
Yeah.
Okay, so, but your
What's your
heart's
driver's
okay
name?
now?
Oh yeah.
After all
No, I
that?
actually have a clean bill of health.
Bryson?
Emory is my
We can decide if you guys are
cardiology
here real
office,
quick and then
and
we'll-
I just did a stress test and all that stuff
Are
came
you
back.
on any medications for your blood pressure or heart?
No, I
Alright.
actually have low blood pressure, so
Okay. And then how about any acid reflux you're on medicine for?
I'm on pantoprazole once a day.
Okay.
So yes.
And are your kidneys and liver okay?
Yes, everything on
Are
my
you diabetic?
No, I'm not. I'm actually hypoglycemic, so on the other end.
Okay, and then are you on any blood thinners?
No.
Ever had a seizure?
Yes.
Not seizure disorder.
I have
you on medicine?
non-epileptic stress-related seizures, but it's been more than 2 years since I've had a seizure.
Okay, and so you're not on medication for it, or are
No.
you? Okay.
I used to take Valium for it, but they don't like that with morphine, so.
Yeah, and then the stroke, that was back when you were
2007. Yeah.
when you were 27.
Yes.
Okay.
Yeah, I threw a clot in the back of my head, so.
And that was related to everything going on at the time, right?
Correct.
Okay. You're taking morphine at home?
Yes, well, you guys are the office that prescribes it.
Okay.
So it's 15 milligrams BID.
Okay. And then are you any drug allergies?
Ultram, latex, aspirin, and shellfish. And I did not take my meds this morning because I didn't want to risk taking
Okay.
too much liquid to drink them or to take them. So I have no meds in my system since 10 something last night.
Okay. And then, any chance you're pregnant?
I don't have a uterus.
Okay. All right.
Best thing ever. I recommend it to everybody.
Yeah. And you said who's here with you today?
My other half. He's got the keys and everything.
Your good other half.
Yeah, I made sure to give him my keys because I'm the one that drove here because he's never been to this office.
Oh, okay.
He doesn't go very far. He's a New Yorker. You know they don't drive.
He's a what?
A New Yorker.
Oh, yeah. Can you go ahead and take your mask down? Let me look inside your mouth. Okay, nothing loose or removable?
No.
Okay,
No, I have all my original parts.
okay. All right, you're good.
And I wore that. I didn't realize you guys would be so busy. I'm glad I brought my mask because, like, cooties. I haven't had COVID yet, and I certainly don't want it now.
Yeah.
And I'm an A negative blood type, so supposedly A negatives or A blood types can get COVID faster than other blood types.
Oh,
What the studies were showing, I was like, yeah, no, I'm gonna stay my happy butt at home.
Yeah, I got you.
Now, is it true what they say? I watched this guy on Instagram, Dr. Sood. He's an anesthesiologist. He said if redheads run in your family or if you have red hair, that you're supposed to tell people. Is that accurate about the pain stuff?
It just means sometimes you can
I mean, I'm medication
you can metabolize
resistant.
the medication faster.
Okay.
Yeah.
Yeah, when I had my first C-section, they had to give me 2 spinal injections because the first one didn't work.
Okay.
Because
Yes,
I
okay.
have been medication resistant most of my life.
That's probably what it is then. You do have a bit of a tolerance.
Yeah, I do.
That's okay.
Yeah, when I went to have my second C-section, they knew about the first one with the double injection, and they doubled up the meds on purpose. But literally in the middle of surgery, I was waking back up.
Oh.
So
okay.
it happens.
Yeah.
So I'm like
Okay.
super
You have a
super
high
tolerant to meds.
tolerance.
You would think it's you know, back then I was only like a $112. Well, I mean, pregnant I was $185, but still.
Mm-hmm.
When I never understood with me being so thin how my body metabolized it so quickly.
It's like, it's just, you think about like a hummingbird, right? They metabolize everything very
Oh, yeah.
quickly, right?
But they also move super quick too.
They move super quick. Some people are just upregulated is what we call it, and that just means that their enzymes just chew through the drugs faster.
Yeah,
It's just, everybody's body's a little different, you know what I mean?
yeah.
So,
It makes it hard when you go to a pain specialist though, and you're like, well, they're
yeah,
like, is it helping? Like, it kind of takes the edge off, but it doesn't really do a lot.
but
you
they'll,
know.
they'll eventually kind of get to know you and what works for you and what doesn't. Yeah.
I was with my last PM&R for like 15 years. He was amazing, but he retired because he was like 70.
Oh.
But he was amazing. I loved him.
Oh,
I was just
yeah. Yeah.
trying to get established here. We moved from Florida to Georgia about 2 years ago. So
Okay.
I was at another pain specialist before you guys.
Uh-huh.
And I only saw the doctor once,
Uh-huh.
but like, it was somebody new every time that I saw, and it was
yeah.
never consistent.
Yeah, that's hard.
And
I
so I
know.
was like, at least when I come here, I have Rita, and like,
Yeah.
she's consistent every time. And
Yeah, that's good. Right.
so, I
Yeah, having
appreciate
that continuity of care, somebody that really understands you
it. Yeah.
over time. All right, well, I will see you in a little bit, okay? You go by Rebecca?
Yeah, that's
All
fine.
right, okay, again, I'm Ashley. I'll get you sleepy and comfortable, okay?
Okay, whatever you need to do. As long as I don't see needles, I'm good.
Okay.
Yeah. So that's what that's what I'm watching. But I'm watching the armor. It's her trial first. His trial isn't for like 3 months. So.
Oh, okay.
Okay. So do you want this on or off? Okay. Yeah. That off. Because it likes to stick to my sleeves. Because it's stiff. So. Stay.
I'm 5'3".
Well, barefoot, I'm supposed to be 5'9". So, so you come up here, and put this oxygen in the middle. Then you take the card. You get me a 30 minutes. Still trying to get over that. I don't get it. I don't know. Crazy. Well, when he hit my daughter with a hammer, even being immobile, I lost my shit. I'm sure he did. Was he just like mentally unstable, or what was the name? Well, come to find out, he was mad at me. Long story short, we dated in middle school. I didn't go to prom with him in high school because I wasn't allowed. Right. So I had to turn him down for that, and this was his payback. He came back into my life when I was like 26 and was like, oh, and I didn't see any red flags. All I knew was that I was working 2 jobs, I was going to college, I had 2 small little girls.
They weren't his.
No, they weren't. And it was like, it was just so much shit. And then, like, you're lonely and you've got so much shit to do and you can't do it all yourself. And I just felt so much shit.
So you fell for all his things. He was helping you with stuff?
Well, he wasn't first, and then all of a sudden he just kind of stopped.
Okay. So
I've
he's,
had a migraine for over 8 days, so I'm hoping this will help.
yeah, it will. So he stopped helping you, and then is that when he got violent, or he started?
He started flagging out at work, and then I found out that he was sleeping with my best friend from high school. That was a lot of fun. And then, it's like, dude, why? Like, I was willing to do anything for you. You wanted education, you needed training, you needed a vehicle. I had the money. I was working, protesting stuff during the day. I did drug enforcement for law enforcement at night. So I had the training.
Yeah.
And then I did legal and another transcription at night, for my mom, because she had practical, and I did gastro, rheumatology, and GP, and podiatry. So I worked a lot of well, in order to be certified to take the certificate, you have to have 2 hours of training for your field, which is all the chemicals, all the chemicals. You also have to have first aid, CPR, first responder, all that kind of stuff. And I kind of really thought I got all my stuff. So, I noticed it.
You what?
Yeah, I must, no, my brain temperature, everything for the birthday.
How you doing? You have done this one before?
I did this one last time.
Okay.
So I've done this procedure where they do like the photos and injections and stuff. So not anything up here.
This one is the test injection to make sure, to confirm if that's the problem in your neck, okay?
I hope so. I hope it will help with my migraines. It's not hurt.
Exactly, you know, if it helps with your headaches, most important day is today, okay? That's the most diagnostic value. It can last a little bit more, but the important is the first day. Okay?
Well, the neurologist was saying something about the, usually use a trauma or
help a lot because this one is diagnostic. Once it's all confirmed, then you can do the ablation. The ablation is the one that makes you last longer.
Yeah.
Yes, that one. Yes. Just making sure.
Yeah, because the last one I did, they did it at another Georgia Pain Center, which is over on, you come up 224, you turn right at the main checkpoint.
Okay.
And that road is right down the road.
Okay.
And I never want to go to Piedmont Montgomery again. The nurses staff was great there with me. They had a neurologist there that didn't.
Oh.
That's lucky. I'm a piece to do this, so. I try to be an easy patient because, you know, I know some stuff more. I'm a patient here. I'm just terrified about the, everything is so,
Basically, it's the same one as the first one that we opened. You didn't-
why they.
Are you going to take a breast too? Yeah.
Hey, darling. Well done. Rebecca.
Okay. I just came here, just, we'll go back out there, okay? You need me for anything? Okay, and then I just told that you got to speak with them about that. Okay. You need me, you good?
Rebecca. Hey, darling. Well
Rebecca.
done.
Miss Rebecca, you're all finished.
Wake up. Rebecca.
Miss Rebecca? Hey, Miss Rebecca. Miss Rebecca?
Rebecca. Hey, darling. Well done. Time to wake up. Rebecca. 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 How big is left?
We have a non-sedation, and 2 sedations, and a non-sedation.
No wonder you're
Hey, Loopy. Miss Rebecca.
Time to wake up.
Miss Rebecca. Miss Rebecca.
Hey.
Miss Rebecca, it's time to wake up. You're all done with your procedure.
Rebecca. Time to wake up, darling. Rebecca.
Miss Rebecca, it's time to go. Hey, Miss Rebecca.
Time to wake up.
Miss Rebecca.
Hey, darling. Time to
You lift
wake
your head
up.
up for us.
Rebecca. Rebecca. Hey, there you go. She's opening up her eyes.
Hey, Miss Rebecca, we're gonna slide your feet off the table.
You gotta push yourself up. Procedure's done, okay? Hold it.
Hey, Miss Rebecca, you're all finished. You set up for me?
Miss Rebecca, come here.
We're gonna put you in a wheelchair, okay?
Come sit down, darling. There we go. Woo!
You're all done. Hmm?
How are you feeling? You feeling okay?
Yeah.
Good. I'm gonna get some vitals on you, okay? You lift your arm up for me real fast. Hey, Miss Rebecca, can you wake up for me? Hey, you're all done. How are you feeling? You okay?
I'm drugged. But thank you for waking me.
You're welcome. Can you take some deep breaths for me, okay? There we go.
She's been out of it for a couple of days now. I was driving her over last night trying to get her medication. And she ran out of it.
Yes.
Hey, sit up for me. How you feeling?
Trying to get my head straight. Wait.
Good.
I forced her in my house. Stop driving.
Hey.
I've seen you in here before.
What's your pain level right now on a scale of 1 to 10?
I'm gonna go with a 10.
Give it a what?
A 10.
10. I'm go grab some. I'll be right back.
Because of that, just make sure he gets all these signed. So just make sure he gets all these Okay. She's in really bad hands.
Oh, my migraine is gone now. It's awesome.
Good.
German arm hair always bursts.
Yes.
Do it for summer. My daughter.
8 hours for solid, 8 hours for solid food, clear liquid, they have to be 2 hours.
They're gonna still do the procedure. They're still gonna do procedure on you. They can't give you no pain.
Can't give you anything that's like, how long ago? How long ago?
They're gonna give you an injection. They can't put you out. Is that going in with us?
Go ahead and sit up for me, okay? You okay?
Yeah, just slowly coming out of it.
Good.
I just wanna hold her hand.
Get it cleaned up for
And is your driver out in the waiting room or in the car?
Get it cleaned up.
He is out in the waiting room. The black guy with wow. He used to have dreads. He has
Dread?
2 seizures.
Okay. What's his name again?
Jason McAlpin.
Jason. Okay. Let me go get him real quick and then we'll go on outside, okay?
All right, thank you.
Go numb it. She's probably gonna pass out.
I wish I could. Still. But yeah. It's now, so,
Does she just leave her stuff right here?
Yeah, when it's time, it's not like.
Rebecca, you ready to go?
So, post-op stuff, what am I needing to do? Because I'm sure this is different than the,
So no driving for the rest of the day. Just take it relax. You can eat in about 10 to 15 minutes. I'll give you some post-op information too to give to Jason, okay?
okay. Don't run her over. She got me tissues. Take care. Have a good weekend. Thank you.
Did you need some tissues?
No, she gave me one. It's in
Oh,
here.
okay.
Actually, no, I pulled it out just in my lap.
And there's this appointment card for you, okay?
Thank you.
You're welcome.
Thank you for the help.
You're welcome.
I didn't even get to see Rita, who's pretty curl pattern. To have the medical professional this year. One time I think I'm very maybe so I won't be able to do. So all in all, things are okay?
Oh yeah, absolutely. It's been great.
So if I wanted a burger after this, I could go get one.
You'll get better.
Yay. So I'm waiting to get today. And you fucked out that.
Oh, she's so cute. Thank you. No. Not yet.
They are great,
Great.
but they,
I have two nieces.
I did want to come back at the very end of this and say that, I'm not posting this for like pity or anything like that. I just wanted to say that, I did record this just because I wanted to see how I reacted, because again, this was the first time that I had done anything like this. The last time I had done anything with like nerve blocking, it was for my sacroiliac, where they went in and I was awake for that procedure, but this is where they literally like knocked my ass out. And they did have a hard time like waking me up from this procedure. So it was a little bit terrifying, because if you notice at about the 40-minute mark, they had a hard time waking me up. And it took them a good 5 minutes to get me to wake up and respond. Like they, at one point, the anesthesiologist kind of sounded a little panicked because she couldn't wake me up. And so when I went back in April for my lower back procedure, when they went in and did the other nerve block that I had done for that one, they used, I did let the anesthesiologist know that I did have a little bit of difficulty waking up from this procedure. And so I don't know if he adjusted what the dosage was. I don't know if he reviewed the chart, but I did let him know that there was some difficulty with waking up on that procedure. And I know he adjusted something, because I did wake up a lot quicker and I was a lot more coherent on the drive home. And, of course, I remember the burger at that time. So I noticed there was a lot of more coherence on the second procedure than this one. Also, you know, I remember my endoscopy and stuff like that. Coming out of the procedure, they use the same types of medication for the putting you to sleep on that one than that they did with this one. So I was familiar with the medication. I'd had it, you know, within at least the past year. Or at least within the past 12 months. So I was familiar with the medication. So my body should have reacted to it pretty well, or had had it recently. So it should have known what to do with it. But the fact that it took so long for my body to respond to the counteract medication, I was a little concerned about that. So that's why when I had it done again and they used the same medication on me again, I did let the anesthesiologist know so that he knew what to do for the future procedures. So hopefully this information is helpful. If you do notice that you know, because red hair runs in the family, I was a redhead, you know, I've always had, I was a strawberry blonde growing up. My hair is like an auburn brown. And so I did let my anesthesiologist know that the first time. So, and I am medication resistant. I've been on opioids for over 20 years. So that is something you always want to let your, you know, anesthesiologists know firsthand. The fact that, you know, when I have spinal injections and stuff like that done, they always have to double the dose of medication because I am medication resistant. So those are all things that are very important to let your providers know before you go into medical procedures like this, so that they are aware before giving you medication, because you certainly don't want to wake up, especially when they've got needles in your neck, because they use machinery like the x-rays, it's a big x-ray machine, it looks like a big C, to position needles, and then they put big needles in your neck to position, and then they put another guide needle in, and then they put another needle in next to it to position stuff and inject things right down into the cervical spine. So you really kind of have to be very precise with those kinds of things. So waking up in the middle of that procedure when you've got, you know, 12 needles stuck in your neck, in your cervical spine, one wrong move and you're fucking paralyzed. So keeping that kind of thing in mind is something that's imperative, because I certainly didn't want to wake up in the middle of that procedure and be paralyzed. So always making sure that you're communicating with your healthcare providers and things like that is imperative. And that's one reason why I recorded this, because I wanted to make sure that I could come back and review it later on. And then of course I did record the second one. The second one went a lot quicker because it was my lower back, and you know, my body responded a whole lot different to the medication the second time around because it was only a month apart, and it seemed to respond a whole lot different to the medication than it did the first time. So anyways, hopefully you guys find this helpful. Leave some comments down in the comments if you have any questions about how this worked, how I went about it, what was needed, you know, how I, you know, talk to the doctors about this kind of stuff, why I got it done, that kind of thing. And anything that you want to know, just let me know, and I'll see about doing a breakdown video on what the procedure was, what medications were used, why I had it done, and I can do a more in-depth video on that. And I will see you guys later. Have a fantabulous day or night wherever you are. Bye.